Thank you very much to our witnesses, and thank you, Mr. Chair. I appreciate you recognizing me. I have a background in intelligence, and I'm aware of the importance of detecting threats early on. So along these lines, I recognize the importance of global health surveillance programs and ensuring that the information gathered through these programs do inform US and global public health approaches. Dr. Jha, in your view, what went wrong in terms of some of our early detection of COVID, and how can we remedy and rectify this going forward?
Boy, I was going to say it's the $1 million question, but it's probably the multi-trillion-dollar question of what went wrong. A lot of things. So certainly, we did not have the kind of global surveillance that allowed us to pick up this disease before China first made the WHO aware. My sense is that this disease, by the time end of December, early January came around, 2019 to 2020, the disease was out. It was out in many countries. We probably had cases here in the United States. We did not have the kind of surveillance system that would have allowed us to identify this. We have largely in the past, and I think we need to really rethink this, relied on countries reporting their own outbreaks. And every country and every outbreak has an incentive initially to downplay it for the obvious reason that they always hope that it'll just go away and then they don't have to make the world aware. I think that is a second vulnerability. And I think the other part is that we really need independent assessment of these data that are independent of WHO. And again, I'm not somebody who blames WHO for all of this, because they are really confined and constricted by the fact that they are a membership organization, and therefore they can do what their members allow them to do. But you need an independent body to assess it. So we need far better surveillance capability. We need a different way to sift through the data, and then we need an independent assessment of that data. We didn't have really any of those things. So in some ways, it is not totally surprising that we found ourselves where we did.
Could you speak just a little bit more to why countries, and presumably just an issue of kind of reputation, but are there any other reasons from a scientific perspective, from a public health standpoint, why countries would be slow to report a situation like COVID-19 as an example?
It's largely economic, Congresswoman. I mean, basically what happens is, when I think about like what happened in West Africa with the Ebola outbreak, and there WHO's failures were far more catastrophic. I mean, obviously didn't have the same global impact, but for months, WHO downplayed what was happening in West Africa and in the Ebola outbreak. And really, because the countries were asking WHO in some ways to downplay it. And the reason is, if there's an Ebola outbreak, you certainly don't get much tourism. Trade and travel slow way down, and there's a reputational impact. And all of those things, countries are very afraid to admit those things early on. It's only when it becomes no longer deniable that countries tend to fess up. But often things the cat is way out of the bag by that time.
With the American Rescue Plan, we included significant resources for COVID testing and tracking, including the detection of new variants, as well as resources to bolster U.S. disease detection and warning systems. Just a continuation on the discussion of what happened at the beginning of the pandemic, could you just speak a little bit to why disease surveillance, even at later stages in a pandemic like where we find ourselves, are critical, and what public health officials seek to do with that information?
Absolutely. So if you think about the variants that are circulating, B.1.1.7, the one from the UK, why was it found in the UK? Because UK does really good genomic surveillance. So they identified the case early. South Africa actually does very good genomic surveillance, and they were pretty early to find the B.1351. The point is, you can't find these things unless you're looking for them. And this pandemic isn't over, and this virus isn't done evolving. And so if we are not tracking these things, if we are not seeing the emergence of variants from around the globe, if we are not able to understand what properties variants have, we're going to essentially be sitting ducks to new variants that are going to get us into a lot of trouble. So surveillance is not the end all, but it is absolutely the first step. You can't really do much in a disease outbreak if you can't track what's happening.
And in terms of just what you can do with that surveillance information, that's what's allowing, we hear about the research of boosters at different pharmaceutical companies, and that's all a result, not to put words in your mouth, but that's all a result of the surveillance. Is that right?
Absolutely, absolutely. No, that's exactly right. And so if we think about these boosters and when will we need them and who will need them, this will all depend on what happens with these variants, our ability to identify it early, see its impact on the population, make clinical decisions about whether we need a booster or not, who needs the booster, build it, test it, deploy it. There's a lot of steps here, but it begins with surveillance.
Thank you very much, Dr. Jha. Mr. Chairman, I yield back.